Welcome to our AJA Lunchtime Live, folks. I'm Kimberly Carroll. I am the director of AJA. I want to welcome all you compassionate souls here with us live. I want to welcome those of you who are watching the replay. We have with us Dr. Charu Chandrasekera from the Canadian Centre for Alternatives to Animal Methods, also known as CCAAM. Folks, CCAAM is Canada's national hub for developing, validating, and promoting non-animal testing methods. CCAAM is a key player in creating an animal-free science future. And I am so sorry to say, but it's in imminent danger of closing down unless we are able to rally the government for some funding, and yesterday. So let me tell you about this wonderful woman joining us here today. Charu is the founder and executive director of the Canadian Centre for Alternatives to Animal Methods, formerly located at the University of Windsor. She's an experienced scientist, a former animal researcher, a science policy expert, and of course, an animal lover. Through CCAAM, Dr. Chandrasekera has promoted the replacement of animals in Canadian chemical toxicity testing, biomedical research, and education through 21st century science, innovation, and ethics. Can we please welcome Charu? Charu, welcome, my dear.
Hi, thank you so much for having me today.
Darling, you're such a loved part of this community. Charu has an amazing module in week 1 of the AJA course. I think everybody sort of fell in love with you then. You've inspired us here before on our AJA Lunchtime Lives, and we're so happy to have you here again, but under really tough circumstances. And in fact, Charu, you are sitting right now in an en route. So for anybody who is outside of Ontario, an en route is a highway rest stop. And that's where Charu is. So can you give us a little bit of, can you share the scene that's been happening for you for the last few days, Charu?
So I want to apologize ahead of time if I cried during the meeting today. This center is not, it's something that's very personal to me because I made enormous sacrifices to build this and to protect it and to bring it to where it is today. So this is very hard. Yeah, I'm sitting in Mallory Town, Ontario. The Highway 401 is right there, which is about an hour and a half west of Ottawa. I'm heading home to Windsor after putting the Canadian Centre for Alternatives to Animal Methods state-of-the-art research laboratory in a U-Haul storage unit in Ottawa.
I'm so
sorry. So the last few days have been intense. It was the last 2 weeks we spent, I don't know how many hours a day packing everything. Just imagine moving a big house, but you have like 50 kitchens essentially, right? All the equipment, little things, there's different things that you use for research. We were doing a lot of different work, 3D bioprinting human tissue and a lot of other things. So we had a lot of stuff to pack and everything was just packed up. And Monday we loaded the truck. Tuesday we drove to Ottawa. Yesterday we unloaded in a storage unit. And today we're heading back. And the only way I can describe this feeling for me is to say, when you go home after a funeral for a loved one, that's how I feel right now.
Oh, Charu. Okay, so let's back it up a bit, okay? Anyway, I mean, it's breaking all of our hearts. But can you give us a brief history of CCAAM? Can you tell us how it came to be and what role it's played?
Yeah, it was one of the most incredible contributions, I would say, in my life as a human on this earth this time around. I think that this would be my biggest contribution to humanity. It was started as a little promise to my kitty cat, Mowgli, whose paw print is on my right wrist, and I think many of you have seen that before. It was the night before she died. I had no idea what was to come. I had just walked away from doing animal research, and the night before she died, I promised her, I said, I will save 100 animals from being experimented on in Canada. That's the promise I made to her. And just 4 years later, I was going to all these meetings. I was working for the Physicians Committee for Responsible Medicine, and then I was going to all these international meetings, and I came across all these people from different countries with national centers for alternatives, and Canada was lacking one. And so I decided to set it up, and that's essentially the gist of the story. And we set up the center, and I brought unprecedented partnerships together. Got Health Canada on board, as Canada's primary regulator of chemicals and drugs and all things animal testing. Brought the academic community together. Even animal researchers work well with me, and brought industry groups together, so everyone, and obviously nonprofit organizations and everything. And so we created this culture in Canada, and the center quickly received international status. So I have a seat at the table alongside Health Canada in international consortia with other centers of this kind in the world.
Well, yeah, I mean, okay, so we don't have this is the only animal-free lab we have in Canada. It's been like the hub, we created this national hub in 4 years, and going strong, lab, people in it, things coming out of it, new discoveries, all sorts of policies being created. So what's gone wrong?
This is the part that I don't understand. When I first established it, we had some unique features that some of the other centers in the world don't have. And especially the partnership that I have with Canadian regulators and these industry groups, it's rather unique. One of the directors of another center, just a couple of months ago, actually said, "I'm envious of your relationship with Health Canada." And Health Canada, the agency, has a lot of scientists who are committed to this. They're doing the internal work to develop and validate non-animal methods as well. So we have everything in place in Canada, except for funding. So for the last 5 years, the research lab was established in 2019, with $1 million donation from the Eric Margulis Family Foundation. So I'm obviously incredibly grateful to Eric and Dana Margulis, and many other donors, even Bob and Judy Clark from Animal Justice, favorites, and many other Canadians who came through. So most of the work was funded by philanthropic, and then I had some industry grants as well. But the idea was always that it would become a true national center with federal funding. Every other country, comparable country, I should say, and remind me to tell you that story, for everyone to know what that comparable means. But essentially, I relied on federal funding. I thought that it would come, and there were promises of it that it would come, but it never came. And as most of you know, universities in Ontario, and all across this country, but especially in Ontario, are doing well right now. So the University of Windsor, I must say that the former administration at the University of Windsor, they were very progressive and forward thinking. The former vice president for research and the dean of science were incredible people. If you go into my LinkedIn, you will see that I have personally thanked them in public and given them awards and everything for establishing the center. And there was a lot of opposition from different people in the animal testing community, but so I was able to have it there, and the university simply ran out of money, and they had to realign. Every single university in Ontario is going through drastic budget cuts. But this is not the responsibility of a single university to protect a national center. The ones in the US, the European Union, all these other countries, they are funded by the federal government. So funding, I must say, is the only reason. We have these academic programs. We were in the middle of launching a master's program. There are so many other things, and these are programs that I designed in collaboration with our federal regulators, with other centers around the world, with academic partners and industry partners to meet the needs of this. Replacing animal testing is not going to be an easy task. And Canada needs to have a voice. We need to play a leadership role. We're lagging behind right now. And without CCAAM, I'm not sure how we would ever be able to become leaders in this field.
So, Charu, for those that, there's lots of folks here today that might be new, might not know tons about the animal testing issue. So I just really want to get a better sense of the stakes for them, for those who might not know a lot about it, can you give us a little bit more of a sense of the breadth and the degree of suffering that animal testing entails?
So animal testing 101 in 1 minute then. Okay.
Mm.
So there are two main forms of animal testing. One is for biomedical research. So this is where you create disease models. This is where you take animals and try to create some kind of a disease, whether it's Alzheimer's, cancer, heart failure, diabetes, muscular dystrophy, and you're trying to model a human disease in these animals to try to understand the molecular basis, the underlying biology of these diseases, right? To understand exactly what happens where, in what organ, in what cell type, and then try to try to develop drugs to target certain biological molecules. So that's where you actually create these diseases in these animals. So animals suffer tremendously. I mean, just imagine having these massive cancers and things that go untreated for months on end, because there's animals are never given painkillers unless they are really in pain. But most of the time when you create these disease models, they go through a lot of suffering. So that's biomedical research. On the other hand, you have another area where it's chemical safety testing, where you test almost everything, industrial chemicals, waste coming out of refineries, waste from mining, and paint and pesticides, household cleaners, anything that you can think of, they all undergo animal testing. And this is where you expose these animals directly to these chemicals, either by forcing them to eat them, to drink them, by applying them on their shaved skin. And this can be just an acute exposure, which is like 24, 48 hours, or most of the time it's much longer than that. There's a 28-day study, 90-day study, and some things like reproductive toxicity to find out if it's toxic to your offspring. 2 years. And many of these animals suffer incredibly painful procedures because they are conscious, they are unanesthetized, they're not on painkillers.
So this, yeah, I mean, I think animal testing, we all know that farmed animals is just this incredible scale and so much suffering. There is something so haunting about animals in labs, alone, being tortured, actively tortured, that I think, just horrifies so many of us. And Charu, like the thing is that there aren't a lot of people out there I would expect that likes the idea of animal suffering in labs. But many folks consider it a necessary evil if we want to save humans. Now, many of us know that that's ethically flawed thinking, but it's not even true. So, can you tell us more about the whole, the myths of the efficacy of animal testing versus non-animal testing methods?
So animal testing is something that's been around for 1.5 centuries, essentially a century and a half. It's been the predominant way of doing things. Animals are still considered the gold standard, whether you're trying to develop a drug or to see if a pesticide is safe. Animals are considered the gold standard. But here's the thing: 95% of drugs tested to be safe or effective in animals fail in human clinical trials. And it's not very different for chemical safety testing either. There are some chemical tests you might as well flip a coin. Is is this chemical safe for human exposure? Yeah, let's flip a coin, head or tails. Because the not the efficacy is not the right word for chemicals, but the whether it is hazardous or not could be 42% in some cases. So animals can't tell us exactly how we will respond to drugs and chemicals. And many of these chemical testing protocols were developed in the 50s and the 60s, like way back when. And that was a time when we didn't have all this new technology available. And so the thought was that it's better to have something than nothing. And then there are some areas like developmental neurotoxicity. So this is just seeing if a chemical is toxic to the developing brain in a fetus. There's no gold standard for that. You can do that in mice and rats, but it doesn't really tell you how it would affect a human baby growing in a mom's belly. So there are a lot of issues with animal testing, that they're expensive, very time consuming. The reality right now is that we have tens of thousands of chemicals in commerce in Canada where we don't have full toxicology profiles, meaning we don't know all of the different adverse effects they can cause. And if we were to rely on animal testing to understand that, it'll take us a few centuries and cost, I don't know how many billions and hundreds of millions of animal lives, essentially, you know. Test a single key ingredient in a pesticide, it takes about 12,000 animal lives for one chemical.
Unbelievable. And I mean, just think about the rapid pace, folks, that science goes at. Our discoveries and the fact that we're still working with a model from the 60s and 70s. That would be like working with a computer from the 60s or the 70s. It's unheard of.
It's the only, this is the thing, I think this is the only industry on the planet that can accept a 95% or a coin flip failure rate and still continue on and uphold the status quo. It's unbelievable. We have a scientific culture ingrained in animal research and testing. It's a culture that considers human data to be anecdotal.
Mm-hmm.
We are a funny creature on this planet.
Yeah, absolutely. Yeah, I can say that again. So, folks, we are going to take some questions. And just because there's a lot of active chat, can you just put a queue before your questions so I can sort them between that and chat. And we will get to those really shortly. So, Charu, we've had a big victory in the past year around animal testing. Can you tell us about S5 and where it's at?
So last year, I called this the year of the maple leaf. For the first time in Canadian history, we passed two pieces of legislation. One was the ban on cosmetic animal testing and the sale of animal tested cosmetics in Canada. We were the 44th country in the world. I mean, it's a shame that we were the 44th. We should have been in the first 10. But nonetheless, we banned it 10 years after the European Union. And then the other one was a really key piece of legislation, Bill S5. These were amendments to the Canadian Environmental Protection Act. And this is the primary piece of legislation in Canada that provides the framework for testing chemicals and for making sure that Canadians are protected from toxic exposure to these chemicals. And that was amended to include a phrase that mandates the government to replace, reduce, and refine the use of animals in chemical safety testing. It was a huge step forward. The US brought in this legislation in 2016. The European Union has similar legislation. And that also mandated the government to come up with a strategic plan to phase out chemical testing on animals. And they had to do this within 2 years. So right now, Health Canada released their draft strategic plan last month. And you can access that online. And I think Animal Justice has communicated this through their blog last week and through this action alert and everything. And you can see that it's a really nice, it's a very high level document, but it talks about what the government of Canada would do to phase out chemical testing on animals. So Bill S5 was huge. It was a landmark mandate.
Mm-hmm. Yeah, absolutely. And one of the things we were especially excited about with S5 was what it might mean to the future of CCAAM. There was actually a mandate in that, something in that bill that was like, he's gonna get funding. So what, can you explain that a little bit more about that?
That was the hope. There were many members of parliament that I had been in touch with, and I think a lot of different groups. We were all under the impression that the government would actually commit money along with the legislation, because you can't just have a piece of legislation. It's just going to become a stale website. At the end of the day, if you don't have money to enact the vision that's outlined in that document, that's exactly what's happening in Canada. The federal government, yes, they were progressive enough to pass the legislation, but there was no money attached to it. So ahead of budget 2024, there were a number of different groups that, including animal justice and animal welfare organizations, academics, industry groups, there were international partners who wrote to the federal government saying, you need to commit to this and especially fund CCAAM as Canada's national hub and the international interface. And I know that there was some language in the budget, in budget 2024, saying that the government is committed to advancing research into non-animal methods, but that's still yet to come. The commitment is just words at the moment. Just, ending animal testing is just a hollow aspiration in Canada at the moment.
Yeah. So there's folks in the chat, Charu, are just like, can we do this? Can we do this? Can we do this? All of this, or and I think they probably need to know how much work you've done around this. We've been doing around this, like just how much lobbying there has been, how many meetings, how many allies. Can you give us a little bit of a sense of what's been happening behind the scenes?
Just recently or over the years? I mean, in a way, everyone is aware of this, right? I mean, that's what I can say in general, that everyone in the government is aware. So one of the things that happened last year was also I hosted the world's largest, most prominent conference in this field. It's called the World Congress on Alternatives and Animal Use in the Life Sciences, and I was the host of this conference. We had over 800 international experts from all sectors, right? From industry, from governments around the world, from other national centers around the world, and academic researchers, nonprofit organizations. And this conference series has been ongoing for about 30 years now. Actually, we celebrated the 30th anniversary last year. And I think my AirPods maybe. Can you still hear me? Oh,
I
okay.
can still,
Sorry.
yeah, we can still hear you.
No, I thought I heard this noise. I thought they were dead.
Yeah.
So yeah, and I brought Health Canada and Environment and Climate Change Canada as co-hosts during this conference. It was the first time two federal agencies or even a single federal agency had become a host. So Canada seemed committed, but there was no money with it. And at the time, I actually said, "Oh, I'm going to announce at the end of this conference that the CCAAM is closing." The financial troubles have been around, right? I have struggled so hard. And I think if you go back to every single animal justice, live thing that I've said, the only thing that was getting in the way was funding, right? So I informed them, and I had support. The health minister sent a message, environment minister sent a message talking about how important the center was for Canada. The parliamentary secretary to the environment minister came there to give a speech about the government's commitment. So all of this has been there. Everybody in that government is aware. I mean, they got language into the federal budget this year, earlier this year. So everyone is aware. So I'm not sure why there isn't any money.
Okay, so let's talk about money. Let's see. Somebody was asking. Oh shoot, I lost them. Okay, yeah. Dennis was asking, Dr. Charu, can you tell us how we can help? What does CCAAM need? Operating funds, 1 million, 5 million, $10 million a year. So the thing is, Charu, you don't even need that much. In terms of government funding, you need what? Tell us what what's the minimum
Okay. Let me first go back to that one thing I wanted to tell you about the comparables. So this is what other countries are doing. The US, they just committed $390 million over the next 10 years. And this is for a new program to set up small centers around the country, in addition to their national center, which receives about $7 million, $8 million in funding a year. The European Union is, off the charts essentially. And so all of these countries now, some of those centers, the US and the European one, they've been around for well over 20 years, so they've been government funded. And the UK, the center in the UK, their annual budget is 17 million a year. I asked for 2 million a year for 5 years. That's all I asked for, because I mean, that's Canada. You're likely not going to get more than that under, what we're going through right now. So it was a very modest ask. And some members of parliament told me not to compare Canada to these economic giants like the US and the European Union. And I said, oh, please, let me pick a very comparable example then. How about the Netherlands? They are half our population, half the GDP of Canada. They just committed 124.5 million euros for their national efforts over the next 10 years, $12 million a year. And you mean to tell me that Canada, a G7 country, doesn't have even $1 million a year to commit to this area? It's unbelievable to me that we are that behind. And just last week and the week before, a prominent scientist from the European Commission who sits with me and with Health Canada in this international consortia, called me and said, is Canada a G7 country or a third world country?
Mm-hmm.
Those were his exact terms, and he apologized for using that term.
Mm-hmm. Mm-hmm. Yeah, we're
So
we're not
ideally,
behaving like the high income country we are.
or
Mm-hmm.
progressive. See, this is the thing, and some people ask me like, why? Well, if there are other centers around the world, why do we need one in Canada? The thing is, we can't wait for the rest of the world to solve our problems. We have 30,000 chemicals in Canada's domestic substance list. Now, this is the list of chemicals that are produced in very large scales, either produced in Canada or imported in very large industrial quantities. We have to find out if those are safe for us or not. And also, since when did Canadians become these sort of backseat people? When you let the world take care of things, we have to show that we can take leadership, do things that we need for our country, and contribute to international efforts and training the next generation. 10 years from now, the world is moving on with or without us. And 10 years from now, we have to have people in this country, scientists, lawmakers, everyone who are well versed in these technologies. So when Health Canada receives an application to get a new chemical approved, there's going to be a lot of data coming from other countries, other jurisdictions with data from these non-animal methods. Who's going to sit and evaluate them in Canada? So there are lots of different implications. We have to protect our health and our environment. We have to engage with 21st century science and take a part of that burden. We have an international space station. We have a Canada arm. Well, why are we there then? Let the rest of the world do all this work. It's the same kind of thing. We have to take an active role when you're a G7 country. So my thing is, the way it is right now, any money would do, but it has to be sustainable. And the amount of sacrifices, personal sacrifices that I made to keep this center alive, I can't continue to do it anymore. I've lost it all. I've lost everything that I ever worked for. And it's okay. If this is how it's going to happen, I can die tomorrow knowing that I did absolutely everything in my power to make this work. But I really hope that Canadians will come together and save this. It's not for me, it's not for you. It's something that's beyond us. It's our legacy for generations to come.
Yeah.
The minimum that I asked from the federal government was $1 million a year for 5 years. It's an absolute minimum. And can you imagine? So what would I do? The UK center is $17 million a year, and the US seven, European one, like when you convert the euros, whatever, it's around 10 million a year. Well, how are we ever going to be competitive? To even meet, forget about being competitive on the global stage, but what are we going to do as a country here?
Yeah, absolutely. I mean, Charu, and I also think it's important to, for us as animal advocates to recognize that, you know, pushing Canada to be a leader in this sort of ethical stance for animals too is an incredibly important place to put our time and effort. Charu, one thing that you has said once before that I remember you mentioning that it takes $2 billion worth of development and testing to come up with one new medication. $2 billion. And I'm just like, and so the amount that you're talking about is a drop in the bucket. And so, okay, everybody is like, they understand. We have so much support for you here. I am going to share the chat with Charu after this, folks. So if she doesn't have a chance to see all the love that you're sending out, she will be able to, and also lots of really great ideas in the chat. But what we want to talk about is what we're going to do to help. Okay, so Animal Justice and other allies, we're in the middle of a big effort to get Charu and the center that funding. And so we have a special job for AJAers because you're our super soldiers. So we've obviously got sort of form emails going out to governments and everything, but we are asking you to do something a little bit more advanced, and that is to call. Okay, we've been asking for calls lately because calls are kind of one of the things that's breaking through the noise. Okay, there are a lot of organizations over all spectrums that do the auto emails. We have more people that will do, folks will do emails to their MPs, but we don't have a lot of people who actually call. And we think that this, if there's enough of us, could make a dent. Okay, and when I say enough of us, I mean even like 100 calls to the finance minister's office in a day is going to make a big difference. Okay. So, Charu, I'm just going to take folks through the action. All right. Kirsten is going to put the AJA action brief into the chat. But what we're asking for is for you to make a call to the Minister of Finance, Chrystia Freeland, and to the PMO's office, the Prime Minister's office. Okay. Now, there's a really good chance that you might get a voicemail. That's okay. Leave a message, take some time with it. You may get a real person. You don't need to even say a lot. But what we're asking for is we are asking for the government to support their commitment to animal-free testing by putting funding behind CCAAM. Right, Charu? That's the basic thing that we're going for. Now, we've got this all written down in the action brief, but that is the number one thing: funding for CCAAM. Right, Charu?
So there are a couple of things happening right now. Absolutely, funding is the critical thing, and I'll tell you, I have a plan. I've come up with multiple plans. I haven't given up on this, so I'll get to that in a minute. So what's happening right now is that Health Canada has this draft strategic plan to phase out chemical testing on animals. The final one is due in June 2025. So they have the draft now, and they're seeking public comment on this. That's due on the 13th of November. So if you could, I mean, you can still write to them after that as well. But if you can I would love to see, I don't know, 20,000 emails go out. That would be amazing. 50,000. I mean, if we can get that kind of thing, that would be pretty incredible.
And that's what we're doing in the animal justice link, right? Which we're also
right with the animal justice link talks about this draft strategic plan, and one of the things we're asking for is obviously funding, but also asking. CCAAM is currently not included in the draft strategic plan as a key player. The name isn't mentioned. It does talk about collaborations with national and international experts in this field or centers in this field, but I would really like to see CCAAM inscribed into that draft plan for its future. So even regardless of what government or what comes into power and over the next 10 years, 20 years, this strategic plan is going to remain in place. And obviously the plan will be updated and everything. So those are the couple of things that are in there to put CCAAM into a Canadian National Centre into that strategic plan, and also obviously fund it. Because otherwise this is just hollow aspirations. How can you have a strategic plan without funding behind it?
Yeah, absolutely. And so folks, okay, so there's the action brief is one aspect of this, but the other is to get share as widespread as possible this auto email to contribute to the draft comments. Okay. And Kirsten's going to put that's all in the action brief too. But Kirsten, could you actually put that link as well in? And so, I mean, I'm sure most of you have already signed this. First of all, sign it. Second of all, send it to everyone you know. Okay. Get it, send an email, explain what this is all about. You can, in the action brief, put out your own social media post that explains why this means something to you. Ask for everybody just to take a minute to, sign this, and it automatically goes to their MP. It automatically goes to the finance minister, automatically goes to the health minister and the PMO's office. Okay. And so so level one, make the call. And sorry, I didn't finish. We also are going to have you phone the health minister. And number two is to disseminate this action around signing to submit these draft comments to as many people as possible. You can also always check out Animal Justice. We are pushing this hard. You're going to see different posts. You can always share those. But remember, folks, it's really most impactful if you take the time to grab an image from animal justice page and to tell your own story. Like, I've heard Charu talk, I've heard these things, this is what touches me about it. And the same thing goes in your phone calls, okay, folks? I mean, if you're nervous about the phone call, just do the bare minimum. I hear that CCAAM, say the whole full name, is about to close. This is a tragedy. Please, talk to please get some funding for this center. Now, this is the other thing. Listen up. If you have a Liberal MP, you're even more valuable in this action. Call your Liberal MP and ask them to put pressure on the finance minister and the PMO's office to do something around the funding. Okay, that is an ask you can do. Again, that may take a little bit more talking about why this is important to you and why this should be important to them and why this is important to the country. Okay, and you've heard a lot from Charu. You don't need to know that much. You don't need to go into that much detail, but find a couple of snippets that really resonated for you and share them. Okay, that is what advocacy is. What resonated? What do you think is going to resonate with them? Catherine says, I'm really bad at phone calls, but I'm going to try anyway. I love that. She says, I have a Liberal MP, but for how long, it doesn't matter. We need them now. So that's really amazing. Again, don't be scared about phone calls, folks. They are here. They work for us. Okay. They're here to get calls from us, to get requests from us. Okay. To get direction from us. Charu, if somebody is calling and they're nervous about it, okay, let's just say they're calling the finance minister's office. Is there anything, like, if they're gonna keep it really short and they're just gonna say we need funding for this center, what do you find is the key couple of points that really seem to sway politicians?
I guess the number one question is that we have legislation and we have a strategic plan to phase out chemical testing on animals. Why aren't you investing in the Canadian Center for Alternatives? There's no dispute about that. This is the national hub. It has been endorsed by the government, right? It's public news. And so I guess that is the key question. We have new legislation. Maybe, if they don't remember, if you're calling your MP, they may not be aware. There are so many different bills and everything. So Bill S5 amendments to the Canadian Environment Protection Act requires the government to phase out chemical testing on animals. But Canada's only Center for Alternatives is now closed. It's not closing. It is technically closed. I just told you I put it in storage. So there's nothing at the University of Windsor anymore. It is in storage in Ottawa. And the reason why it's in Ottawa is because I feel that for the next phase of this mission, if it survives, I would like to say when it survives, I would like to reopen it in the nation's capital so I could have strengthened partnership with Health Canada, with industry groups, with academics, and really be that hub here. I feel that in the long run, this is the place to be. So we can restart it. And the way I would say it right now for me is CCAAM is on life support. It's not totally dead yet, but it will. By the end of this month, it's either going to survive or completely be gone. It's that critical. I have not needed help from anyone more than now. So if you can at least, I don't know, get 5 family members, friends, or whomever, flood those email addresses with this request. The easiest thing is to just use the language that Animal Justice has been distributing to get as many messages in there as possible. And this is one of the things, and I think I've said this before too, and I said this in front of the parliamentary committee when I appeared as a witness, to get the language strengthened in Bill S5 to phase out chemical testing. And one of the things I said is that every time I go give a talk abroad and I talk about how far behind we are as a country, people always ask me, why don't Canadians care? And I've never had an answer for that. And I asked these members of parliament from all parties, what is the answer to that? And I still don't know. But I think this is the time that we really can show that we care.
It really is. Okay, So Nikki says, Dr. Charu, I use these words very sparingly, but you are one of my heroes. Thank you. Okay, so we've got folks going. So let me just review. First step, making the phone call. If you have a Liberal MP, calling them. If you absolutely cannot do phone calls, do a personal email. We've included that information as well. Second step, taking that that animal justice link that will allow you to automatically have your comments sent to the draft, and sharing that with at least five other people, okay, directly. Those are your marching orders, AJers. Do we have folks on board? I'd like to see it in the chat. Who's on board for this? Who's committing to taking action here for CCAAM and for the future of animals in animal-free science in Canada? Committed. Me, I am absolutely. Thumbs up 100% right after this meeting. Yes, capital letters. Me, I'm on it. Yes.
I
Yes, I
promise
love
you,
it.
I promise you, I've done everything in my power. I can't talk about all of my personal sacrifices in a public forum like this, but believe me, I've made the ultimate sacrifice to keep the center alive.
Yeah.
I have.
Yeah, I know, darling.
And
I know.
and the center was officially closed at the University of Windsor at the end of May. So I've technically been unemployed since then, and I'm still working 10, 15, 18-hour days right now. I haven't stopped, and I have not started looking for another job, anything like that. I'm still fighting to save what I think Canada should have.
Mhm.
I don't know what else to do.
Yeah,
So
absolutely.
if it ends here, then I guess
Yeah,
it does.
yeah. Well, we are not even close to giving up here. So I know that you are so tired, so fatigued, but also Charu, I love that you've been in media in the last couple of weeks. CBC, you've been in some, major newspaper articles. We've been, from animal justice. I know we've been in the war room trying to figure out as many places to get you in front of people, and you've been just representing this issue so well as per usual. Let's get into some questions, though, some more questions, okay? So from our community, we've got a lot of questions of folks, can you do this? Have you done this? All this sort of thing. What I'm actually going to do, because we don't have time to grill, Charu and all this, but these are great, some really interesting ideas. So Charu, I'm going to send them all to you, and Charu can obviously go, yeah, done. Ooh, something, maybe a possibility that I haven't explored, which I kind of doubt it, but you never know. So I'll make sure that you have all of that. But Jay Scott has asked, has any MP been asked to submit a petition to address this issue? Shara, do you know that?
I did. I prefer not to get into the details, but I'm not sure at this point it would be worthwhile. But this letter writing campaign was based on advice from a number of MPs as well. So we can still do a petition really quickly. So it'll be read in the if you get 500 signatures, I believe you can have it read in the House of Commons. But what's critical right now is that Health Canada as an agency apparently does not have money. But the new money has to come from the finance minister, which is why we're really pushing all of them, though, Minister of Health, Minister of the Environment, Finance Minister, and the Prime Minister. Because remember, the 2021 Liberal campaign promised to end toxicity testing in Canada by 2035. That'll never happen. Never. Not at this
Yeah.
rate.
Yeah, absolutely. Okay, Jenny, and quite a few people are actually asking this question. Would PCRM consider funding you in Canada? There's also big UK orgs that I've followed for years. Now, I don't know what the relationship
I'm
is
not sure
there,
I can
Char.
answer that question.
Yeah. Okay, got it. But
Yes.
it's been explored. So that's enough said with that. It has been explored.
No,
Okay.
no, it hasn't. I'm not saying, it's not the responsibility of foreign organizations to
Yeah.
I just, and plus I have a conflict of interest because I work for them and all of that. So I'm not answering that question.
Yeah, got it.
So,
Okay.
but you
PCRM does
know,
great
anyway,
work.
yeah,
We're
yeah,
trying to get the government to do this. Yeah, we're
yeah.
trying to get the government to do this. Okay. There's a really good question from Jeremy and Nisha. And I just lost it, but I'm finding it. Just one second here. Can you please summarize some of your main wins, results we can share in our advocacy as examples of animal-free testing being a viable solution? So I think this is an interesting thing, Charu, just especially for those that are taking, trying to convince their friends and families as well, about what the viability is of non-animal testing methods. So maybe just give it, I love when you talk about, the organs on a
Yeah.
chip and things like that. Can you tell us a little bit about some of those things that we could pull into the narrative?
So there are lots of different technologies. So replacing a living, breathing organism that we've been using for the past 60, 70 years, especially for chemical testing, is not a simple task. And you have to really think outside the box for this. And I usually use the term think outside the cage to do this. So there are lots of different technologies, things where you look at something at the DNA level, right? Looking at how your genes behave in response to a chemical, to how your organs, how does the liver process a drug, and how do all these other, there's a plethora of responses the human body elicits when you're exposed to a drug or a chemical. And so you have to combine different computational models, cell and tissue based tests, and even chemical reactivity in a test tube, and even looking at population studies. So if you are living in a community with exposure to certain pollutants and all that, you can just simply collect blood and urine from people and epidemiological data to understand. So it's a combination of all of these different technologies, but some of the things that so there are different groups specializing in different areas. The US Center, for example, they focus a lot on computational models. Here in Canada, part of our focus has been on creating human tissue models. So we had a 3D bioprinter, creating this liver in a dish and lung in a dish to test like toxicity of chemicals, how they affect the lung and the liver and the GI system. So we created this is just one example. We had so many different projects, but one quick example, the lung model. Health Canada is actually going to use that in a real validation study to see if this lung model can become a substitute. So around the world, with Canadian efforts and with efforts from other countries, people are making real progress, replacing sometimes one animal test at a time, sometimes multiple sections of different protocols, and replacing them at the international level. The Organization for Economic Cooperation and Development, they have a chemical test guidelines program, and Canada is an OECD member. So 35 countries, they sit around the table, they evaluate these technologies, these protocols and methods, and they're like, okay, now this is suitable for this particular test. So let's replace the animal one. It's happening, and it's happening fast. It is happening. We are seeing measurable progress in this field. And, like I said, some of the big countries are now investing even more, and they have national strategic roadmaps, the legislation to phase out chemical testing on animals. So it's becoming real. Oh, it has become real, and it's going to get even bigger as we move forward.
Yeah, absolutely. So Charu, thank you for that. The more that we're sort of armed with those those inspirations, the better. This is a question that's come up a bit. Just folks wondering about Charu, about like how do people donate now to CCAAM? If you're no longer with the University of Windsor, there are folks that are donating through that. Is that still coming to you? And if people are wanting to do some serious fundraising for you, how do they do that?
So at the moment, I don't have anything set up. So the University of Windsor link and the website will be rather obsolete within another week or two. I think the website is still up, but it'll come down. One of the things that I have done that I hadn't really made public yet, but I can now. I did register a CCAAM as a federal not-for-profit. I had to, in order to save the instruments, and there's some funding, there's a small amount of money that was left over from the grants, from the money that I had raised before. So all of that now belongs to a federal not-for-profit. It's now called the Canadian Institute for Animal Free Science. I don't like the word alternative, so we renamed it, rebranded it, but I have not put anything together yet. So I cannot quite accept any funding at this, like today, but if that is something that we can do, we can certainly set that up. And then, as I said, there are plans underway to take this to Ottawa, and as soon as the plans are finalized, which would depend on long-term funding, sustainable long-term funding, I can share those with you. And I mean, I would obviously greatly appreciate people coming together with funding, but I don't have a mechanism to accept the money right now, not today, but it will be very soon.
Okay, amazing. And also there'll be social media around that too, hopefully, again, if the things go through. And in the meantime, you think the website is probably going to only be up for another week or so, but your social media will continue on the same handles and everything?
For the time being, yes.
Yeah.
Yes.
You'll probably just change the name.
What's critical right now is to get as many letters as you can by the 13th deadline, and obviously continue to send after that as well. For the next, between now and next Friday, can we please get 25,000 letters in? I think that is the most critical thing at the moment. To really, because I think that there's no other time. We don't know with the political situation when the government, will change, or when an election will be called, or everything is uncertain, right? And with everything that we've accomplished so far, I think it's really important to do that right now. But
yeah, absolutely. Everybody wants to throw money at you, Charu, but but right now
I'm
your
touched.
phone calls and your sharing of the petition, the comments petition is gold. Okay, that is what's gold right now. So
yeah, and share it with anyone. I think that, I don't know if there are other celebrities or even other people in the country, investors or whomever, who might have a say in this. I haven't been active on social media in a while with the center, because it has been unbelievably busy here trying to get everything. I mean, the lab was up and running until very recently, right? Until 2 weeks ago when we started packing, because I wanted to get a lot of work done. I still have PhD students and people. I don't know what to do if it closed forever. I don't know. My current PhD student, Hannah, can you come over for a second? Can I just show you up for a second? Just sitting here. So this is Hannah, my PhD student. She's my mini me. You should see how she talks to. She met with the Minister of Health, and she said, "Minister Holland, I will never touch a mouse. I want to have this opportunity to be educated in Canada in this field, and I'm a proud Canadian. I'm a proud aspiring young scientist. I want to come into this field." And so, yes, they have kept me alive. This 23-year-old is the most mature 23-year-old, and she's my mini me. My God, she's my exact copy. Do you know how many other students come to me every year to asking to be trained in this area? There's so much we can do. We have unique initiatives in Canada that nobody else is doing, and it would be such a shame if we didn't train the next generation to think outside the cage.
Yeah,
because there are so many Hannahs.
Yeah, Hannah, thank you, Hannah, and yeah, keep propping her up, because she's she's tired.
I know she can't hear you because I've got my...
Okay,
but well, yeah, so we are everybody is hoping the best will happen, that we can get ourselves out of life support and into a real place again.
It's all there. That's the oh my God, that's why folks.
This is what I'm saying. For the first time in the history of this country, we have new legislation. We have a national strategic plan and an internationally recognized center for alternatives. What are we missing?
Yeah, I know. Nothing. We're missing nothing except for some dumbass folks to get their act together. So, folks, you got your marching orders. It's in the AJA action brief. Please do one, both, all if you can. And again, everything's in the link in the action brief. The link to share is the number 3 in the action brief. So make sure that you're paying attention to that as well. And we'll update the action brief really shortly with a few more details that Charu has shared with us. All right, so Kirsten, are you still there? And if you are, can you take us off of the spotlight so we can get back to the gallery view? Yes, Hillary, Kirsten just shared that action doc. Okay, so Charu, can you see the gallery again? Can you see everybody?
Let me.
Yeah, go back to the view.
Gallery.
Yeah, okay, you got everybody. Okay, so folks, I just we know how hard she's been working. Debbie says we got your back, Charu. Denny says thank you, Dr. Charu, for everything. Sarah says, as a student from Windsor Law School, I am so upset we've lost your research on campus. Someone said CCAAM is a Canadian gem. It's outrageous the government is letting it slip away. Angelique said, packing this most important, innovative, world-changing, animal-saving, and valuable center. Dr. Charu, sounds like a lot. We are here to offer all support. There is so much love happening here, Charu. And can we unmute everybody? Kirsten, can we just unmute everybody so we can say out loud, Charu, thank you so much. We love you. Thank you very much. Everybody, you can unmute yourself and say
Thank you so much.
Thank you.
Charu.
So much.
We love you.
Yes, hello.
You.
We love you.
For everything you do.
Thank you for everything you've done.
Thank you, everybody.
Yes,
Charu,
here.
we're behind you. We'll do everything we
Sure.
can.
You're
Okay?
a Canadian gem, Dr. Charu.
You're a gem. Are you hearing all this love, Charu? Drink it in.
Okay.
Okay. Thank you.
It's
Okay.
you know, I think in human history there are times when you have to really come forward and do something that's bigger than yourself. You know, believe me, I can find a job. I can just live a normal life. I don't need this kind of stress, but I'm also not willing to give up yet. I'm not. I think this is something, and I could never break that promise I made to my cat Mowgli. I can't. And there's so much that we can do together. I think Canada is a very special country. We have these partnerships, and this is what I'm saying with the partnerships that I have built. I've worked so hard to build with people, with the government agencies, with industry, with academic partners, the Canadian Council on Animal Care. I even have a good relationship with them. It's working with everyone to change a paradigm. It's once in a century. I mean, the time is now for this. There's no other time to do this. We have everything in place. We have a ship that should be sailing smoothly, but it's anchored in place. That's what's happening in Canada. And so
Well,
let's save this journey, the Canadian Animal Free Science journey. I'm ready to do this. You know, I was telling someone I just turned 49 a couple of months ago, and I said I've got another 30 years of fire. Who knows? But I don't give up. And if some of you find out, you know, the personal turmoil that I have gone through, not just this with the center, you would be surprised. And I still haven't given up, and I won't. But I can't do it alone.
Yeah,
I really need your help.
That you and your team are doing, Charu, we can at least spend 5 minutes making some damn phone calls and sending some damn emails, right, folks? All right, everybody, thank you so much for being here. Thank you for taking action. You are just so special, all of you, and together we can make power happen for animal-free testing, animal-free science. Charu, thank you so much. Thank you, everybody.
Thank you.
And
thanks, everyone.
Let's make some change, everybody. Take care. Bye-bye.